AM 1240 WGBB.com, and 1240 WGBB Freeport.
This is Healthy Living Radio with your host, Dr. David Scharf, a compelling program featuring today's top healthcare professionals. Join us as we explore the latest treatments and technologies to provide better care in today's ever-changing world of health and wellness. Now here's your host, Dr. David Scharf.
Healthy Living Radio. You're listening to Healthy Living Radio, dedicated to bringing you the latest advances in health and wellness so you can live better, healthier, and longer. I'm your host, Dr. David Scharf. Tonight we have we're going to have a great show for you. We have a great guest, Dr. Richard Michaelis, general dentist in West Babylon. Rick, welcome to the show.
Thank you. Thank you for having me, David.
My pleasure. I wanted to have you on the show because you're really well known in our South Shore areas as the go-to dentist, the go-to family dentist, and especially for people with some tough dental problems. So let's just talk a little bit. Let's start. Tell me, where'd you grow up?
Grew up in West Islip.
Is that right? So you came back to where you started?
Absolutely. I presently still live in West Islip and practice in this area my entire life.
Where'd you go to dental school?
SUNY Buffalo.
Okay, and then you came back. What did you do after school?
I did a residency program at Flushing Hospital Medical Center for 1 year. General practice residency where you do continued all phases of dentistry.
Mm-hmm. And what exactly happens in a general practice residency? Is that something every dentist does, some dentists do? Why would you do that after dental school?
It provides a extended course of study in further specialty areas in oral surgery, orthodontics, that you don't just get in dental school. Mm-hmm. And it's a segue going into private practice, so you get further training.
So you really come out at a much more advanced level than the average dentist who just comes out of dental school and starts practicing.
Oh, absolutely.
They mean it when they say practicing. That's what they're referring to. And then I know you just moved your office as well. You used to be in West Islip, and you just moved to a state-of-the-art facility. So why'd you make that move?
Well, the new office provides me with greater space, and I was able to improve the quality of care that I provide my patients because the room that I have and the increased room for technology that I've incorporated into the practice. It's a brand new facility, and so it's really nice. Yeah,
it's really beautiful, and I encourage my listeners to stop by. He's right on Sunrise Highway. It's just beautiful inside, very relaxing place, very well decorated. A lot of thought went into building it, so I give you a lot of credit for putting that effort in for your patients.
Thank you. It was really a pleasure designing it and putting all those touches that I really always wanted to have in my practice.
Mm-hmm. How old were you when you decided you wanted to be a dentist?
I was in high school.
Yeah.
It was probably around 11th grade that I was making that decision, as everyone makes, of what am I going to do with the rest of my life. Mm-hmm. And short of being a beach bum or fishing for the rest of my life, I focused on dentistry.
What was it about dentistry that appealed to you?
I always used to make things. I used my hands a lot. I used to build, tinker, and make. Mm-hmm. But I enjoyed the sciences in school and did very well. So I combined those two studies of using my hands and the sciences, enjoyment of the sciences, to go into dentistry, which is a combination of both.
And here you are, 20 years later, plus.
Here I am, yes.
That's great. So let's get into the topic tonight. I want to talk a little bit about cosmetic dentistry, smile makeovers, that kind of thing. And what does that mean? You hear that phrase a lot, cosmetic makeover or smile enhancement. What does that mean?
Well, for people that want to improve the way their smile, their teeth look, and it can encompass just a single tooth or it can encompass the full mouth. Mm-hmm. There's a wide range of what we can do cosmetically, from simple to involved, and even the simple can make a huge improvement for people.
Yeah. So it's not always a big production when someone doesn't like their smile?
No, not at all. Most people are worried or concerned that it is going to be very involved, and I think that can keep them away from the dentist. But now we have many techniques, very simple techniques, not involved techniques, to make a very big change. Mm-hmm. And you see that on the faces of the people that you do that for.
I've read statistics that only about 50% of the population ever goes to a dentist on a regular basis. So I would guess that you see a lot of patients who, haven't been to the dentist in 5, 10, 15, 20 years. Is that a common thing that you see?
Very much so, yes. Yeah. And once they've been away for that many years, it's a greater difficulty to go back. Mm-hmm. There's a certain amount of fear that they have, fear of embarrassment and what the dentist might say. But we're not judgmental. Mm-hmm.
The problem probably grows in their mind exponentially with every year, every minute that passes.
They just spend too much. It's like a small child just thinking about it too much, and just keeps them further from making the appointment.
So what would you say are the top 2 or 3 reasons maybe someone who doesn't go to the dentist on a regular basis doesn't go?
Probably pain, fear. embarrassment. Those are the
What are they embarrassed
three.
of?
Just what they're going to hear and what the dentist might say.
Do you think it's
the unknown?
Do you think it's a typical thing in the past, maybe, or other dentists that they would give someone the I can't believe you haven't been to the dentist in 15 years?
I'm sure that could be a big component of it too.
Yeah. Why do you think dentists would do that? I happen to know you well, and I know that you don't do that. But how do you handle that with a patient? Maybe they come in and they seem a little embarrassed or uncomfortable. When their mouth is in such disrepair and it's obvious they haven't been to the dentist in a while, or if they've been that they just haven't taken care of the problems. How do you handle that with them to get them over that hump and make them comfortable?
Well, our focus in the office is to see what condition they have, and we focus on what condition they have and what we can do to make it better. There's no discussion as to why it is the way it is or why it hasn't been addressed before, other than to help assess how we can best help treat them.
Mm-hmm. You never know what someone's reason was for staying away. You can always assume it's one thing, but who knows? It could have been, they could have been in Bali working with the natives for 20 years and didn't have access to dental care. You never know what it is.
Absolutely.
Or they had other priorities that were just, at that time, took precedence.
And a big part of the new patient is really speaking to them and really trying to listen to them and hear what they have to say before you rush into doing any treatment.
Well, let's talk about that. I think most people haven't had the experience where a dentist actually talks to them and that they don't have cotton in their mouth. So what's the experience like when a new patient comes to your practice? You mentioned that you talk to them or there's an interview process. Take us through what happens when someone calls on the phone through their first visit.
Well, when a patient calls, we're going to first assess whether they have any pain. If not, then it's really just an initial visit to assess what their needs are. So that involves taking x-rays and doing an examination of the mouth. Beyond that, we'll also take photographs, study models to help assess any diagnostic determination of what their needs are. And then we'll have them back, and a large part of that first discussion and the second visit is discussing with them what they want, where they've been, what they've done, what their desires are. And then we can then better help treat them.
I bet people's response is almost one of surprise that you're actually taking the time to talk to them, find out really what they want as opposed to what you want for them.
Oh, yes, very much so. Usually the comment is, I've never had anyone ask me so many questions or spend so much time talking about what I need. It's always about what they want to do for me. And I find with a lot of the projects I've done, I know planning is 9% of the project. And so for me, that discussion time is paramount to really helping to determine what they need. I know I can do lots of different types of dentistry. It's important to find out what they really want and need to help, make them happy. And that's the whole
thing,
yeah.
the whole important thing. And I would think that goes a tremendous way just in terms of helping them feel comfortable.
Yes, absolutely.
So we have maybe fear of being judged. The second one you said was just fear of pain, fear of discomfort. So how is that handled in your office? And what do people typically, someone who comes in that's maybe afraid it's going to hurt, which, who wouldn't be afraid that it's going to hurt? Who would want to be hurt? But what do they typically find once they've been through some treatment in your office? How do you manage that for them?
Well, usually most people are very surprised about how painless it was. We have now many different techniques as far as injection to give anesthesia that is comfortable and truly is painless. It's just important of using the time and the effort to properly do it and not be in a rush to get onto the dentistry.
Sometimes patients will tell me that previous dentists, would give them the Novocaine in, 10 seconds it was in. And, I've watched you do it, and I know that you really take a long time, and it sometimes creeps the patient out that it's taking a long time, but it actually makes it painless.
Yes. They'll comment, wow, that was the longest injection I've ever had, but I never felt a thing. And that's important.
I would guess once you can treat someone comfortably like that, they send their friends and one happy patient that you keep comfortable like that must result in 10 more patients calling up and wanting to be treated the same way.
Oh, absolutely. If you're known as the dentist can give a painless injection, people are going to talk because that's a big important part of the fear people have is that pain of the injection and the pain that follows.
So let's change tracks a little bit. Who's the typical patient, that comes to your practice?
Well, I have what I call a family practice. So the typical patient is a person of a family. And I don't know if there's any real typical patient. I have young and old. I treat children 2, 3, 4 years of age up to the elderly, up to 99 years of age, my oldest patient I've had in the practice.
After 99, you stop. If they turn, if they turn the odometer one more digit, you cut them loose. So let's talk about kids, because I know a lot of family dentists or general dentists really don't enjoy treating children, but I just see your face as you're talking about treating kids, and I know that you enjoy it. So what is it you like about treating kids?
Well, I always find the challenge of taking a child and giving them a positive experience. And they walk away feeling good about the dentist. It's so disconcerting to see people, adults, talk about how they hated their dentist, what a bad experience they had. And knowing what we can do and what we do, there's no reason to have that. And it's a shame that people ever had that, but there's reason now ever to have it.
I wonder if many of the patients who have been away from dentistry for a long time, when you talk to them, if they relay that back to you, that it was a horrible dental experience when they were young that really set them on the wrong course throughout their life.
Absolutely. It's those early experiences that set the tone for everything to follow, and that would keep them away.
What are some of the common things you see in kids, that you treat?
Well, for the most part, it's early cavities.
Kids still get cavities?
Kids still get cavities.
How do they get cavities?
Oh, I tell you, there's many sugars out there, and pretty much acidity in the mouth and sugars will contribute to decay.
Do you see a lot of injuries in kids, or are all kids helmets, mouth guards, shin guards, everything now? Do you still see a lot of dental injuries in children?
Oh, absolutely. The mouth guards they have to wear in school, but it's when they're practicing outside of school that they develop the injury, or just playing on the playground or playing with their friend. Somebody hits their head or swings a tennis racket. Yes. So we see a lot of injuries in kids.
And how do you manage those?
Well, it's getting back to the time we spend with our patients. I find if you spend enough time talking to the patients, and the children especially, that it really helps to allay their fears and not rush into doing the dentistry.
For the kids that are listening tonight, do they get a compass and a whistle if they're good at the end of the visit with you?
Yes, and stickers.
Okay, stickers. Kids, call tomorrow.
That trip to the treasure chest is always a home run.
I used to love that when I was a kid. I still have vivid memories of the little piece of junk I got for being good in the chair.
We can't get the prize in Cracker Jacks anymore, so now you have to go to the dentist.
You get that. So we spoke about kids a little bit. What kind of dental problems typically do you see maybe in teens and people in their young adults?
Well, the really issue for young adults is some of it cosmetics, because now they're really looked at how they look, and their self-esteem is really impinged upon that, perception by others. So they start to become more concerned about their smile, how it looks, the discolored old fillings they might have, silver fillings if they had them back when they were even younger, spaces in their teeth, and so forth. And that's where the children are now, young teenagers are looking at nowadays, because everything's about how they look.
So for some of them, again, it doesn't sound like major redos, just tweaks to enhance things.
Just tweaks, and it can make a very profound impact, just tweaking a single tooth for a child. Sometimes you don't realize what impact it has till you actually do it. They realize a lot of their self-esteem and their lack of confidence was based on even that one tooth that kids would give them a hard time about, but they might not have came home and talked about when they were home.
It's funny, sometimes when you look at someone else, we all look at our face so much. So you look at someone else and they have a little chip or a pimple or a little something, and it's nothing. But to that person, it's huge. And
absolutely,
self-esteem in a child or a teenager is so important. And just like you said, they may not mention to the mom or dad, "I feel bad about this," or embarrassed to mention about it. Do kids ever say anything to you after you fix those problems for them?
Absolutely. I mean, what we'll see is, and even the parents will relate it. We'll fix a tooth, or we'll bring it up that we can fix this, and we fix it, and the child comes back with such a different demeanor, and the parents will relate how they act so much differently now, and they didn't realize what an important thing it was for them at the time.
Yeah. It's always one thing I find gratifying about dentistry, I'm sure you do too, is it's not just fixing the teeth. It's really the person that's attached to the teeth and the difference that dentistry makes in their life. And I think sometimes that gets minimized.
Oh, absolutely. And certainly by speaking to the patient, talking to them, trying to find out what their needs are, it helps towards better treating them, because you are treating the whole person, not just that one tooth.
What types of dental things do you see maybe in older people? Fast forward, they're in their 40s, something like that, or in, God forbid, in their early 50s. What sort of dental problems do you see there?
We're part of now, huh? Well, certainly a large part of that is cosmetics that they never addressed. And now they're pointing to life. The children are getting married, and now they look at themselves and want to make a difference. They want to change. Or the person that is changing jobs and suddenly realize the importance that their smile has to the impact that they have for a prospective employer.
Yeah. Do you see that a lot with the economy being what it is, that people are doing something, finally fixing that gap or fixing their smile to get an edge in the job market?
Absolutely. In fact, we almost see it more now where people feel they need to have as best appearance as they can have because there's large people looking for that same job. And, the smile is so much important factor of the general appearance. You don't realize what an impact it has.
I'll tell you, I bet you in addition to how the smile looks, it's the confidence that the person has, how they feel once they don't have that liability in their smile anymore that probably comes through to the employer as much as having the space filled.
When we make a change like that, it's huge. They come away with a newfound sense of confidence and that they never had. And, I remember treating a woman that had just a single tooth that was broken, and she finally fixed it, and it changed her whole demeanor as far as how she felt about herself and how she projected herself to others.
Really? Just from one tooth?
Just from a simple one tooth.
And how long had that tooth been broken?
It must have been 10 years that it was like it was, discolored.
And why do you think she waited so long to fix it?
Not sure. I mean, a lot of times people are afraid that it can't be fixed, that it's going to either cost a lot of money. They're afraid to ask because they don't want to know the answer. Mm-hmm. In her case, it wasn't. She just thought there was nothing that could be done.
Amazing.
And we just sat and talked to her about, we showed her before and after pictures of what could be done and the costs involved, and it was enough for her to say, well, that's it. That's all we can, let's do it.
I would imagine you have to tread lightly. If you see something in someone's smile that you can fix, but you don't know that it bothers them, you can't say, how do you feel about that snaggletooth, Mrs. Johnson? So do you wait for people to bring it up to you? Do you bring it up to them? I would imagine you need a lot of tact to on the one hand, let them know what's possible, but at the other side, not offend them if it's not something that bothers them.
Absolutely. We'll first ask the patient, are there any concerns you have with your smile? Mm-hmm. We'll have a questionnaire that will go through a lot of things about their smile if they wanted to change. If they're not looking to change it, we
leave it as is.
Leave it as is, exactly. We're not looking to sell them in any course of treatment, but we want to ask questions to find out if there's concerns, and many times they'll relate things over time, and then we can then present options of what we can do.
So you're really just answering that question as opposed to saying, hey, you should do this, you should do that, you should do that.
Oh, absolutely. I think for anyone, when you tell them what they need to do, they're less likely to want to do something.
Mm-hmm. And what did she say to you once you ultimately fixed this problem for her?
I wish I'd seen you early and someone else wanted to do this for me.
Yeah. We're going to take a fast break and then we'll come back. You're listening to Healthy Living Radio. I'm your host, Dr. David Scharf.
This is Healthy Living Radio with Dr. David Scharf.
Okay, we're back. We're talking with Dr. Richard Michaelis, family dentist in West Babylon. You're right on the borderline of West Babylon and West Islip. So you're almost in West Islip. You used to be in Babylon, and then you moved to your new office.
Yes, it's right next door to 231, between 231 and Deer Park Avenue. So
you mentioned before just about technology and some of the things you have in your practice, and I know you have quite a bit. Let's talk a little bit about. I know you have digital X-rays in your office as opposed to film-based X-rays. So, what's the advantage to the patient of choosing an office that has digital X-rays?
Oh well, digital X-rays are far superior to the old film-based technology that's out there. It provides 70% less radiation to the patient. They're able to utilize the X-rays to see more than we could before. And it's as comfortable, and it's able to be visualized. And
no chemicals, right? No more
no chemicals.
Polluting.
That's huge.
Mm-hmm.
When I built my office, a large part of it was building a green office.
Mm-hmm.
And I definitely didn't want to have any chemicals in the office. I designed it with everything in mind regarding green CFLs and no VOC paints and
really
green insulation. Yep,
that's great.
So radiant floor heating. I have no combustion, no furnace in the office. So
really,
yep. There's a lot of thought that went into it.
I didn't know that.
Yeah,
I'm going to take my shoes off next time I'm there and walk barefoot and see how that feels.
Sit down on the floor, very comfortable.
Nice and toasty.
The IT guys love to sit and do their technology. It's very comfortable.
It's nice and warm. I know also you were telling me before the show we were talking a little bit that you use lasers to diagnose decay. So let's just talk about that. What was the old way that the decay was diagnosed, and how is a laser used?
Well, the old way and the current way that's still being utilized is the use of a sharp instrument called an explorer to feel for soft spots in the teeth. The new laser technology, a tool called a diagonodent, we'll use laser to determine if there's any decay that's not detectable by using the Explorer. And it's just another tool in the toolbox to help to diagnose and find early decay. And the importance of finding early decay is that we can treat these when they're smaller, and it's more minimally invasive dentistry.
And that's the other thing I wanted to touch on is I've read this, this whole concept of minimally invasive dentistry, and that's been a real boom to the patients. And I think most patients don't understand what that is and what the advantage is to them. So again, let's maybe talk about the old way dentistry was done and what it means, the fact that you do minimally invasive dentistry.
Well, minimally invasive dentistry is getting to the decay early before it gets much further into the tooth. A smaller decay means a smaller filling.
Does decay ever stop on its own, or if you don't treat it, it keeps going?
No, it does stop. We really focus on prevention using a fluoride and reducing the acidity in our mouth, because we can diagnose decay early and track it with the use of digital x-rays, whether it's getting further or it just stops. Many times it's called arrested decay, and it will stop where it is and doesn't have to be treated.
But what about, so now let's say there is some decay that needs to be treated and you do some minimally invasive dentistry. Let's talk about that a little bit. What's the advantage of that over just a plain old silver filling?
Well, with the use of white fillings or composites and not using silver fillings, we can drill away less tooth structure and place our restoration. The restoration doesn't utilize metal. There's a lot of concern with the metal fillings, but metal fillings require much larger tooth preparation to place it.
And does that weaken the tooth when you put a metal filling?
Absolutely. The more tooth structure you take away, the weaker the tooth is. So with minimally invasive dentistry, you're getting to the decay earlier and you have a stronger tooth, and the filling will last longer.
So do you try in your dentistry to really get away from the use of metal altogether?
Absolutely. There's very few cases where I'll use any metal in the office, whether it be for fillings or when I use crowns. Even the crowns now, we have far superior crowns, all ceramic crowns that can be utilized as opposed to using the metal crowns.
So let's talk about that a little bit, because I think a lot of our listeners, or just people in general, our listeners are much smarter than the average person, but I think people in general assume a crown is a crown is a crown, and almost like they're buying, a gallon of laundry detergent they're going to buy at a Costco or the supermarket. It's all the same. But I know you were telling me before the show that they're really not all the same, that the standard issue insurance company crown is really different than an all ceramic crown. So let's talk about what the differences are there. Why would somebody want an all ceramic crown versus the metal crown that, say, an insurance company is going to give somebody?
Well, certainly the all ceramic crown is a far superior aesthetically looking crown. It looks much better.
Why does it look better?
There's no metal margin, so many times when people say, I see this gray line around my gum line, that's from the metal crown.
The edge of the crown is metal.
So they see that, and they think it's decay. It's just the metal margin of the crown where the gum is receded or where it was always visible. The other issue is the fit. The new ceramic crowns have a far superior fit over the metal.
Now those, again, you were telling me before the show that those ceramic crowns are made by machine as opposed to a human being. Is that right?
Yes, many of them are made directly off computer scanning of the impression that was taken, and eliminates the human error aspect of fabricating the crown. And so the fits, usually they go into place, and the margins are just beautiful, and they're very healthy for the gum tissue surrounding it.
So you don't have the issue of quality. I mean, the quality is consistently high. It's not like, okay, the lab tech was in a rush because it was Friday afternoon, or it was lunchtime, or he had a fight with somebody.
Yeah, we didn't get the
before.
rookie lab tech doing the work this week.
Yeah. I would imagine it saves everybody a lot of time. It saves you time, and it saves the patient time in terms of having to have the crown redone if it doesn't fit well.
Absolutely. It's much faster as far as to remake or adjust the crown because of that.
Yeah. I know also there was an article in the paper a while back that a lot of these insurance company crowns, have sometimes metal in them that aren't, lead, or they're made in China. That the quality control isn't what it necessarily should be when people have a crown done based, and their only criteria really is price.
Absolutely. The reason why they're done more predominantly, I think, is they're a lower cost crown. And there is a concern that what's in them. I mean, a lot of people have metal allergies. So even if the metal is not a problem as far as having lead or anything like that. There's an issue with that large part of the percentage population have metal allergies.
Do you think most people sort of realize how much better a ceramic crown is than a... Do people come in realizing that these ceramic crowns are so much better, or do you really have to take time to explain it to them? Has public perception caught up with reality that these crowns are really so much better?
I think the people that have had the metal crown and then have the ceramic crown, absolutely. They are your ambassadors to explain you have to have these type of crowns. Mm-hmm. The people that have never had a crown may not understand the difference. So their insurance will pay for a metal crown and not as much towards the ceramic crown. And it's important to explain to them the importance of the quality of what you're putting in.
When you said before that the ceramic crown fits much better than the metal crown many times, does that translate into it lasting longer?
Absolutely, because if the fit is better, it won't catch bacteria at the gum line and cause decay around the margins. Crowns most often are replaced because of either the patient wasn't happy with the look of the crown, the aesthetics, mm-hmm. or new decay forms that requires the removal of that crown.
They got a cavity at the edge of the crown.
Exactly.
So really the cheaper insurance company crown in the long run isn't any cheaper because it has to be changed.
Exactly.
Right? And no one ever knows if the next time around they're going to have insurance.
And that's why the insurance does that.
Do you ever find sometimes that someone had a poor crown done and you take it off and that tooth then can't be used again? You almost have to take the tooth out or do a root canal or do something with it because that first crown was just such a poor crown. It almost caused more harm than good that it did good.
Absolutely, and it's very disconcerting when that occurs because then you have to step back and explain to the patient how what you plan to do is now suddenly changed, mm-hmm. and explain to them how, just like you said, you couldn't see underneath it and all this destruction took place.
Yeah. Where do most of your patients come from?
The community. They come referred from other patients that have been to my practice.
A happy person tells another person, and so on and so on.
Absolutely.
Yeah. Before the break, you told me about that a lot of people in terms of the job market are starting to want to improve their teeth. Do you see a lot of people, before the wedding or before the big event, finally that's the impetus that they come in and want to look great for that special day?
Oh, absolutely. There's a lot of special days out there. Mm-hmm. Certainly, it's the parents who are the daughter or son getting married, and now they're going to be in front of that camera again, and they want to do something different for themselves. Or the person going out into the job market, mm-hmm. Now suddenly have to feel self-concerned about their appearance where they weren't thinking about it before. The person changing jobs.
Mm-hmm. What's the oldest patient you ever treated that you did something cosmetic for?
Probably a woman in her late 70s.
Yeah.
Had lost some teeth, was going to have to wear a denture, had a denture, wasn't happy with it, and did implants. Mm-hmm. And just 2 implants to support the denture. And it was phenomenal, the change, what she felt about it and what she could do for something so simple.
How long had she been wearing a denture before she decided to do some implants?
She'd been wearing a denture for over 10 years.
Really?
And it just was never presented her as an option that could be done.
No one told her about it?
From what I understand.
Yeah.
And we just talked about it, showed her some models of what could be done, and she jumped on it.
So what was her daily function like before she had the implants to hold her denture in place, and then what was it like after she had the implants?
Well, she would use a tube of adhesive to hold the denture in place, and then she would, place another tube of adhesive after lunch to hold it back in place, and she was limited in what she could eat and bite down and chew with.
A lot of people think when you use adhesive for your denture, it's just as good as having teeth. Is that not the case?
No, denture are not a replacement for teeth. They're just a replacement for not having teeth. Mm-hmm. So they compare no way to function of real teeth or having implants to help support it.
So what'd she say to you after you finally finished this and she came back for her next visit? What did she say?
Well, her choice of what she could eat was just through the roof.
Mm-hmm.
She was limited in what she could eat. She couldn't bite into any real breads. Biting into an apple was never even a thought to her. Unlike what you see on TV, everyone seems to bite into apples with dentures. It just doesn't happen that way.
Doesn't happen.
No, it doesn't.
Doesn't happen. And it's funny, as people age, so much is taken away from them. Their mobility maybe goes down, some of their senses decrease, whatever happens. But really one of the few joys you can have almost till your last breath is to enjoy food. And what a gift to be able to give somebody to really be able to enjoy whatever they want for whatever time they have left.
Oh, it's so true. In fact, one of the statements she said was just along those lines that, there's not a lot of things I can do, but I certainly enjoy eating. Mm-hmm. And this has given me back the ability to eat
Yeah. What do you think more people don't ask about? Hey, I hate this denture. Can't you do something about it?
I think, one, they have preconceptions of what's involved with doing it. And perhaps they've never been presented or talked to their dentist about what can be done for them, or the dentist didn't talk to them about it.
Do you think sometimes patients themselves think, well, I'm too old for that. I'm 78. What am I going to start with this for now? Do you get that a lot?
Absolutely. They say, they always use that I'm this old approach. But one of the oldest persons that have implants that I've done, and their story is the same. I want to enjoy eating. It's what I can still do. And whether I'm going to live 3 more years or what have you, I can do it for that length of time.
And isn't it funny, you hear that I'm this old at 60, at 70, at 80, at 90.
Exactly.
It starts around 50, but it's always kind of a funny thing. So let's just talk for a second. If any of our listeners want to get in touch with you, how can they come see you?
Well, they can call the office. The phone number is 321-1418.
And where are you located?
I'm on Sunrise Highway on the south side between Deer Park Avenue and 231. The address is in West Babylon, 928 Sunrise Highway, West Babylon. Just
to the west side of Route 231.
Exactly.
Right. So what would you say to, in the final 30 seconds to somebody listening now who's been on the fence about getting their mouth looked at least? What would you tell them?
Come, make an appointment, listen, we'll talk, experience what can be a very truly satisfying experience, talking and finding out what can be done for you.
Yep.
And I think usually that first step is all that needs to be done.
The first step's probably the hardest. After that, it's much easier.
Indeed.
Much easier. Well, Rick, I want to thank you for being on the show.
You.
It was a great show tonight.
Thank you for having me.
Thanks for tuning in. I'm Dr. David Scharf. You're listening to Healthy Living Radio. We'll be back on next week. Thanks for listening.
You've been listening to Healthy Living Radio with your host, Dr. David Scharf. Join us next week for another edition of Healthy Living Radio.